So my name is Dani Valdes. As you said, I'm the president of the Music Therapy Association of Washington. So we are here on behalf, we have a booth upstairs, you should check it out. On behalf of every music therapist in Washington State, we support music therapy in Washington State, mostly meaning we support those practicing music therapy in our state. So we have an online directory. We have slips up there, so if after you hear me talk, you're interested in seeking music therapy services, you can find a music therapist that's the best fit for you. So a little bit about me. I went to Seattle Pacific University, got an undergrad degree in music therapy, and then I went on to a clinical internship where I worked mostly with children on the autism spectrum, working with behavioral issues. I also worked with children that had experienced intensive trauma and had behavioral issues due to that. I worked with war vets. I worked a little bit in a juvie center. I worked a lot in memory care. So our field can touch a lot of different people. So let me tell you about music therapy. Music therapy is an evidence-based practice of using music to achieve non-musical goals. So we take goals and objectives that whatever our client may have, whatever our group basis may have, and we address them using musical intervention. So similar to any other therapist, we have a process where we assess the clients, we assess the group, we see what we want to work on. But what's very, very different is we are proficient in a large variety of instruments, and we know how the brain processes music and how music can be effective as a reinforcer, it can be a motivator, and it can also achieve a totally different side of communication. One of the biggest things that a lot of people have heard over time is that when we listen to music, when we interact with music, our brains light up like a Christmas tree. And you can see like brain scans of it, and it's insane. And there's a lot of YouTube videos of, you can see people interacting with music in ways they typically can't interact. Someone may not be able to speak, but they may be able to sing. If your language center is disrupted, your brain has this amazing thing called neuroplasticity, where it can reroute and redirect the brain and actually recreate a new speech center in the brain. And one of the best ways to implement that is through singing. So that's a small example of the huge field of music therapy, but it shows that we're using a very alternative, but very, very scientific-based principle to achieve our goals. So personally, I've worked with the populations I listed, but there's also music therapists that work in medical settings, work with PT, OT, physical therapy, occupational therapy, speech therapy. There's music therapists that work in hospice care, memory care, pain management. There's music therapists that are there when women are giving birth. There's just a huge, huge, huge breadth of our the people we serve. I would actually love to take questions, because I feel like that's the best way for me to direct. It's a big,
awesome.
Big field.
Yeah, let's do it. So I know there are wide-ranging applications, and once again a reminder, if you have a question, we have volunteers in blue shirts. They'll bring you note cards, you can write them down. If you need help writing something down, they'll help you with that. But wide-ranging applications for music therapy. So Dani, what are some of the goals, and how do you go about the process of achieving those goals?
Yes, so a lot of our goals, again, we assess every client, and our assessment we can pull from, if they're previously working with behavioral therapist or a counselor, we can pull from that information, or we can do an assessment. So a lot of the goals I work on, let's say if I'm working on impulse control, and I'm working on impulse control with a 6-year-old child on the autism spectrum, and they kind of is exhibited by difficulty with taking turns and sharing. So I would implement a song, maybe on a xylophone, where I'm playing. I use a song that they either know or they're comfortable with, or they can learn really quickly, and where I clearly state in the song when it's my turn and it's their turn. They're motivated by this, because if they're not doing their turns appropriately, I will stop the song, and nobody wants the music to stop. And it reinforces that behavior of when they do listen and they are following the instruction of the song on the turn taking, and my turn, your turn, the song actually moves out to completion. So the goals can be behavior like that. There are a lot of music therapists that work in physical therapy on gait training. A huge motivator in having a steady gait is rhythmic, and it's a lot more fun if you're trying to learn your gait training if you have a song on with a nice beat or something that's motivating you to walk with a beat. As people, we are very motivated by music. We're motivated by the elements of music, rhythm and melody. It's really case-to-case basis, but like I said, since there's such a variety of populations we serve, the goals they're really endless, and music therapists get very creative with how to implement different methodologies.
Those are great examples, thank you. My friend Jake here has a question.
Hi, I was just wondering, you said you worked with a bunch of different populations. Can you talk a little bit about if you have any insight or experience with brain injury in music therapy? You mentioned neuroplasticity. So.
Yeah, so I personally have worked a little bit with traumatic brain injury. A lot of music therapists with a medical background work extensively with this population. And actually, it's the same principle, exactly what you said. It's neuroplasticity. So if you're working on rerouting speech, rerouting movement. This isn't exactly my field, but I've read the research, and the speech component is it's very not obvious, but it's very straightforward as to you sing to rebuild your speech center. And actually, oftentimes the gait training is what I said with traumatic brain injury. If you have a physical deficit because of that, can actually be implemented. That is a huge. Some music therapists only work with traumatic brain injury. I have done it very little, but there is a large portion of our research that actually goes into that. And on our website, the really nice thing is when you look for music therapy, you can see what they specialize in. And a lot of music therapists in Washington actually specialize in traumatic brain injury. So,
we have another great question. This was, any examples of working with somebody on their job? So at their workplace and in an employment setting, and how does that go over, and how do you get their employer on board?
Yeah, I actually used to be, so for 4 years, but when I was in my undergrad, I used to be a job coach for people with disabilities. I worked through the Washington Initiative for Supported Employment. Actually worked alongside Prevail with that, and I actually had certain clients where we were learning steps. So if we were working at our job and we have to do step 1, step 2, step 3, it has to be in that order. That can be super boring. And it's a lot more fun if you have a song or a rhyme, or you say it rhythmically, and it becomes entrained. It becomes, it's like you can get it's like you learn your ABCs through song, and I have to sing through the ABCs to remember the ABCs. Similar thing. So, I've implemented that in the past, and to get employers on board, it's what I've done. It's just a bigger conversation of understanding what our field is, and that our field is effective, and that our field is very evidence-based. So everything we're implementing is based in research, it's based in things that I've worked in the past, and we know how to implement music in an effective and a safe and a fun way. And so sitting down, having that conversation about just the field in general.
And I'm guessing it's also an opportunity, right, to create a conversation with an employer about the power, one, of this sort of therapy, but also to kind of applaud their efforts in employing this person, whoever that person may be.
Exactly. And two, the communication styles are completely different for so many people. The beautiful thing about music and people's relationship with music is it typically begins at the very earliest moments of your life. Moms sing lullabies to children. It's something that's been there, and it's something that's really safe. So maybe I'm coming in, if someone's coming in as a job coach or coming in as a therapist, or they're in a new work environment, this is weird, this is foreign, this is new, I don't know what this is, but you have a pre-established relationship with music, so if you're using tools in that way, you're gonna have a really safe, supportive foundation for people to work under.
We spend a lot of time in my family with therapists, OT, PT, vision. I'm wondering what sort of educational background music therapists have.
Yes, so music therapists all have to complete a 4-year, you could do undergrad, there's a master's level 2 music therapy program specific. From there you go into a 6-month full-time clinical internship, and you have to achieve, I believe it's total 2,100 direct client hours, which is it's a lot. So by the time you're sitting down, the next step is your board exams. You have to pass your board exams, and you have to continue to be certified. Every 5 years you go in for a recertification process, continue education, and eventually retesting happens. So music therapist is a very specific thing, a very specific program, a very specific test. And that's because you want to make sure to have a very comprehensive background, because music, you know, as we have seen a lot, is very powerful in a positive way. A song can make you cry because it's beautiful and it's gorgeous, and it brings up a memory. But in addition, music can also, in that way, it can, if you're implementing it to someone who isn't able to verbalize that they're uncomfortable with that song is bringing up negative emotional feelings or negative memories, you need to know how to read and to be able to keep that person safe and to not implement music in a negative fashion. And so both sides music therapists are trained in to just have this box of, this is how we implement music in a way where really the client is in charge and you're giving them their voice through it.
All right, we have a specific question. We love these. This is from a member of our audience, and it's a practical question. How do you transition out of the pattern step 1, 2, 3? So can you walk us through the specific process that you go through with music therapy in that situation?
Okay, so if I were to do so this actually goes into a subsection of musical therapy that's neurological music therapy. And so essentially understanding the point in which you're using the musical the goal isn't to have someone walk through their life doing everything musically. So eventually you have to remove the musical stimulus. You have to not be dependent on